is to work with the research team as well as the practice support coaches to make sure that we're meeting the deliverables for the contract.
Great, that is super helpful. And I see that Alex has joined us, so hopefully, yep, she was able to start the recording. So we are now recording. Thank you so much. Thank you, Alex, for joining. So we should be fine now, Alex, if you need to go back to your other duties. So that is very helpful. Thank you, Debbie and Chris. I'm a little bit familiar with AHACs. Several jobs ago, I used to work for the Association of American Medical Colleges, and so worked in the field of medical education. But if you could just provide a little more general context for all of our team members on sort of AHAC, the North Carolina AHAC and its mission, I think that would be helpful.
Sure. So AHAC overall, its mission is to recruit, train, and retain the state's healthcare workforce in North Carolina. It's been around since the early 1970s. It was one of the first AHACs in the country. It's one of the larger ones too. We have about 5 or maybe 6 service lines around graduate medical education, library science, practice support, continuing professional education, healthcare career pathway development. We even operate a fleet of small planes that transport UNC and Duke faculty around the state of North Carolina to give talks or to staff clinics around especially in rural areas. But practice support, our job really is around training and retaining the state's healthcare workforce with a focus really on independent primary care providers, and we work with independent specialists too, federally qualified health centers, rural health centers, and health departments that have primary care clinics. That's really our main focus because their resources tend to be more limited than than those clinics that are owned or operated by health systems. Now, we do work with some health system practices, but not that many. We have relationships with maybe around, the number kind of goes in flux from year to year, but it's around 700 practices around the state. And so our team has 9 regional AHAC centers spread geographically across the state. And within each of those centers, they all have those service lines represented that I just mentioned, and practice support being one of them. And so at each of those centers, we have anywhere from 3 to 5 or so coaches located covering a geographic territory. And so our job is to help these organizations, these practices survive and thrive in a value-based world. And so that can run across different types of services. It's quality improvement, practice facilitation, EHR optimization, telehealth optimization, clinical workflow redesign, Medicaid managed care education and issue resolution that's in the state of North Carolina. Also Medicare quality payment program, and there are other things like patient-centered medical home, and then just general practice management assistance. So a lot of that work is one-to-one from the coach to the practice, working either on-site or virtually. And then there's continuing education arm that we use where we do webinars and we perform virtual collaboratives where folks from the practices can partake on a given topic and learn best practices and share experiences. So that's kind of what we are doing in a nutshell. But Debbie, you may have some things that I may have left out.
Oh, I thought that was great.
Yes, thank you.
My iced coffee is working this morning. There we go.
There we go.
I thought it was a beer. So that's good.
No, it's not a beer. It's a coffee.
Oh, interesting. I lived in Japan like 10 years ago, and canned coffee was really big there, but I have not seen it in the U.S., so I guess it is.
Yeah, I'm trying it out today. It's pretty good.
That's good. That's good to know. Great. that was very, very helpful. Exactly what I was hoping for.
And we also work on health information exchange too. I forgot about that. So we do a lot of training and optimization with practices on that as well.
Great. So it really sounds like you cover the gamut of all major issues relevant to primary care these days, and with transformation and changes to measuring quality and value-based care. Great.
Shauna, before you go into the next question, your audio is kind of doing what it did yesterday, where it goes in and out a little bit. You get quiet and then a little bit louder. I can still hear you most of the time, but it just gets pretty faint at times.
Okay. Thanks for letting me know. I will, something's been going on with my audio, so I'm going to try to stay close to my computer, and hopefully that will help you hear me. So that is very helpful introduction. Now we would like to hear from your perspective, how recruitment has been going. We talked a little bit yesterday with, Dan and Colleen, but I think it's great to talk to you guys who I think are closest to the practices about, how that's going, any barriers, that you've encountered, and we've heard about barriers across from all teams, but just to be able to hear a little bit more from you.
Debbie, I'll defer to you first.
Okay, I'll start, and I know that you'll fill in, so thanks. I think that it has changed over time. Originally, there was, with a new project, new topic, new way to engage on a interesting clinical topic that could have real outcomes for people. We started with a lot of enthusiasm, and it varied a little bit by our regions, but some regions had really kind of a list of people they lined up as probable candidates or most likely willing. And then it coincided with the pandemic, and it just quickly became very difficult to maintain interest. Although we have those practices that originally showed some interest, we thought, well, we'll just keep them warm. We'll just check in with them from time to time, and maybe they'll be able to come online at some point. And I think this kind of mirrored the country's, absorbing what was happening. Like, you would get a break in the pandemic and you thought, okay, we can start maybe moving forward, or let's put out some more recruitment announcements. And then, that's the same time everyone would start going to like Thanksgiving or birthday parties or something. And then 6 weeks later, you were in a real mess again. So we've kind of, I'd say, surfed the pandemic, but we would, kind of get our hopes up again for some bandwidth opening in the practices, and then we would get shut down. And I think we're seeing that again now, because we just thought about, well, let's start advertising at the end of August, beginning of September, and now we're seeing the Delta variant. It's like, timing. I think we do. What I'm pleased with, though, is we do have a group that has kind of stuck with us and are really kind of going through the pains of the project. And I mean the pains that are largely caused by electronic health records and the quirks of the different systems. This isn't a national measure where it can just be, it either takes some programming or starting a registry or doing things by hand. And for those that have continued during a pandemic, and with all of the barriers of the electronic health record, I'm really impressed. I think those are clinicians that just really are committed to the topic. Also, it being a new topic, I think didn't necessarily help us with recruitment. It's like, well, we're concentrating